our children that in today's society we are constantly bombarded with messages from the media, telling us what to eat, what to wear, how to talk, act, and dress, and how to be cool. And as a result, it's nearly impossible for parents to steer their children in the right direction. The most widespread effect that the media has in today's day and age is on body image and on the definition of beauty. We always tell our children that beauty is on the inside, that is what's in the heart and mind that counts. But the media, via the internet and the TV, is spreading a much different message. Specifically, that we need to fit into a certain standard in order to be considered beautiful, with an emphasis on size and weight. This necessity to conform to a media-driven image is causing a major problem among American youth, particularly through an increasing development in teen eating disorders. According to the Renfrew Cancer Center Foundation for Eating Disorders, up to 24 million people of all ages and genders suffer from an eating disorder, anorexia, bulimia, and binge eating disorder, in the United States. That is 24 million people in the US alone that feel they need to mistreat their bodies and make themselves sick in order to feel beautiful. And as teenagers in an egotistical, technology-driven world, we've experienced firsthand the pressures that the media can put on today's youth. And this pressure is not what we want for future generations. We are here today to spread awareness on the truth behind eating disorders. The truth is that an eating disorder will not make your children beautiful. It will make them sick. And the more awareness we can spread regarding the serious effects that eating disorders have on the lives of teens and their families, the closer we can come to not only helping them recover, but to steering them on the right path towards self-acceptance. There are three main eating disorders: anorexia, bulimia, and binge eating disorders. All three are both mental and physical illnesses. Anorexia is self-starvation or purging. Bulimia is a cycle of both binging and purging, and binge eating disorder is strictly binging or overeating. All of these disorders can result in hospitalization and even death if left untreated. So it is very important to recognize the symptoms and warning signs early in order to prevent your child from becoming dangerously ill. The earlier the detection, the greater the chance for recovery, making it imperative to understand and be able to quickly recognize any symptom your child may exhibit. Overarching warning signs that one should look out for are obsessive connections between body image and self-esteem, withdrawal from usual friends or activities, excessive exercise patterns, frequent consumption of large quantities of food, followed by odd behavior, and attitudes that are largely controlled by the ideas of weight loss, dieting, or the overall control of food. Eating disorders are difficult to recognize because, for many children, erratic diets and eating habits are simply the norm. In some instances, unfortunately, the truth may be much more severe than a juice cleanse gone wrong. For bulimics, this means a discoloration of teeth, swelling of the cheeks and jaw area, calluses on the back of hands and knuckles, a constant disappearance of large quantities of food, chaotic, variable moods, and an obsession with control. Signs and symptoms of anorexia include a denial of hunger, food rituals, excuses to avoid meals, comments about feeling overweight, large weight loss, and cautious, shy, or perfectionist attitudes. Those with binge eating disorders frequently consume large amounts of food, eat unnecessarily, and often feel ashamed or out of control.
Now, if your child has an eating disorder, get ready for the long haul. Eating disorders are serious. They are mental illnesses that cannot simply be cured with a magic pill. And they're going to put tremendous stress on every member of the family. So you're going to need to be very supportive as a whole, and remember not to take the child's eating disorder personally, or it will beat you. As a Bloomfield local eating disorder specialist and psychologist, Susan Gottlieb, has said, in order for the affected person to get better, everyone in the family has to look at their role in the eating disorder and be willing to make necessary changes or sacrifices to help in the patient's recovery. The first step is always to get help. However, these patients tend to be type A and their disorder stems from their need to control. So you need to phrase questions almost like you would a child, such as, I am very concerned about your health. Who would you feel more comfortable speaking to? Dr. Spencer, Dr. Marshall, or Dr. Reed? This is because you need to give them a sense of control, but not total control, because like drug addicts, they will do everything humanly possible to satisfy their conditions. However, like depression, eating disorders are reoccurring, so you need to maintain a positive relationship with your child. You and your child are not enemies, the disease is. And think about the side effects in the long term, because if your child has not already died at the age of 18 because of a heart attack, they're going to have either a heart condition from extreme strain or early onset osteoporosis, and they could break their hips, their back, and their wrist. Or other side effects are infertility, increased vulnerability to drug addictions, and difficulty maintaining a stable relationship. And particularly for people with anorexia, if they become so malnourished, it will affect every organ in their body, including their brain, their heart, and their kidneys, and this damage is not always reversible, even if the anorexia is under control.
As my colleagues have stressed over and over again for the past few minutes, eating disorders are more than bad habits. They are life-threatening diseases which are prevalent now more than ever in American society. But we aren't here to bore you. While we could have gone on and on about an eating disorder symptoms and the ways in which they can tear a family apart, the reason why we wanted to put this presentation together in the first place was to discuss what you as parents can do to try and prevent this problem from starting, or in some cases, worsening. Being models of healthy self-esteem and body image is the #1 thing you can do to help your child. It is also the most difficult. Everyone has their insecurities, and for adults of all genders, weight and physical appearance is an incredibly sensitive topic. But simple things such as increasing body positivity for oneself and others, and referring to all body types in a respectful and appreciative manner will go a long way. There is no surefire cure to this disease, no medicine your child can take to become immune to it. In our superficial, nothing tastes as good as skinny feels world, children everywhere are becoming more and more pressured into developing the aforementioned habits. To educate yourself and sit down to speak with your child about the things we did today would make a tremendous impact in both of your lives. With awareness comes an avoidance of judgmental or mistaken attitudes about food, weight, body shape, and eating disorders. Do not let the media poison your children's minds with their backwards, hypocritical ideas about body image. Talk back to the television when you hear a comment or see an image that promotes a certain body ideal at all costs. Rip out advertisements or articles in magazines that make you feel bad about your body shape or size. And please, stop affiliating this with happiness, because over time, it could turn into this. Please, for whatever small amount of people do wind up watching this video, listen to what we have to say. If not for your own sake, then for your child's. You can save not only their health, but also their lives. Thank you.